The Social Health Authority SHA will ensure full benefits for every Kenyan and consequently reduce scenarios where most Kenyans have had to do out-of-pocket payments. SHA Chairman Dr. Timothy Olweny says the National Hospital Insurance Fund was no longer suitable as it was not all-inclusive and had lesser benefits for members.
Primary care, which focuses on promotive and preventive instead of curative, is part of the benefits in the new scheme that does not exist in the current health system.
We're doing screening for illnesses which didn't exist before. That is also being done at the primary level. Then we've got at the curative level, we've got an expanded package. For example, oral healthcare services and the dental services did not exist before. We have got some family planning services, for example, are covered. That was even there before. But there are additional services which we have, which have been introduced under this cover. Palliative care, we're even paying for mortuary fees, which we didn't do before. So in the entire spectrum.
Primary care level is aimed at reducing late diagnosis of illnesses. The current NHIF will be replaced by SHIF, that is Social Health Insurance Fund, to which individual members will contribute 2.75% of their gross income.
The man and the wife, for example, are working. You take their income, consolidate it, and it's 2.75% of that. That becomes the same as 2.75 being deducted for each person from their employer, especially for those in formal employment. But it's 2.75% of gross family income.
This percentage has been deemed exploitative for high-income earners and couples.
That situation is not static. We have seen people who even were high-income earners because of illness have become low-income earners or non-earners. In that situation, things will be flipped and they'll be taken care of. But you also have to remember even the high-income earners do contribute towards everybody else's healthcare needs, not just their own. Even in these circumstances now, you have got relatives who fall sick, friends who fall sick, you raise money for them. So what we're doing is you're also contributing in advance.
The lowest premium is 300 shillings, with those still unable to pay catered for by a loan facility.
We have got even those in lawful custody are going to have their premiums paid. So you have got the principle is anybody who is able to pay will pay. Anybody who can't pay will be paid for. And that's why we're talking about universal coverage.
The unemployed 25-year-olds will not be left out either.
Anybody above between 18 and 25, if they're still in school, in full-time and don't have income, can be dependents. But beyond 25, you have to be a household on your own. They have to have cover. So the question is who pays for it? Either his parents, or if he's employed, if he's got a job, he pays himself, or the government pays for him. 25-year-olds get sick also. And 25-year-olds, in fact, are even more prone to more serious type accidents. In fact, at that age group, most of the time it's accidents which can be extremely severe and extremely expensive to treat.
In the scheme, fund footed by the Exchequer will cover emergencies and chronic illness cases.
In terms of chronic illness, we had got people who had got illnesses where you exhausted your benefit under NHIF. Now we've got a second wallet. So now for those who exhausted the benefits under the Social Health Insurance Fund, you can be able to get additional benefits, whether it's chronic illness, whether it's cancer, whether it's diabetes, whether it's hypertension. Before, we're not covering ICU care and HDU care. That is covered under critical illness now.
The new scheme is also aimed at ring-fencing funds for improving infrastructure at public health facilities to address the lack of drugs and equipment. Come Monday, the 1st of July, all Kenyans will be required to register either on phone through the USSD code *147# or Ministry of Health portal with biometrics done separately. Those without internet access can visit designated centers for the registration that will end in 3 months. Kamchemenza for Sunday Express.